Hello and welcome to Straight Talk. I'm Ayşe Süberker. The coronavirus has spared almost no country, attacking every corner of the world. But sharp contrasts have begun to emerge. Although enjoying similar living standards to Europe and North America, the countries of East Asia, which were the first to be hit by the outbreak, have dramatically reduced their rate of infection and death toll. Aside from obeying strict orders of social distancing and quarantines, these countries have also been turning to technology to battle the virus. Let's take a look at this report. To get a better understanding of the role technology has played, I'm joined from Hong Kong by Benjamin Cowling. He is a professor at the School of Public Health at the University of Hong Kong. In Washington, D.C., we have Georgios Petropoulos, a research fellow at the MIT Sloan School of Management. And from Ankara, we have Emre Huri, an associate professor at Hacettepe University's Faculty of Medicine. Gentlemen, welcome to the program. It's good to have you here. So, Georgios, I want to start with you. Having seen the first surges, how do you think the Asian countries like Taiwan, South Korea, and Singapore have managed to tackle the spread of the virus since its first outbreak and have proved to be much more successful than, say, Italy, Spain, and the US?
I think they were quite successful in convincing and enforcing social distancing. And technology plays some role on that, and also on running many tests, not only to people that they were suspicious that they are infected, but also general tests to as many people as possible if they didn't have the symptoms. And this is important because this particular virus, in many cases, is asymptomatic. You are infected without knowing. Mm-hmm. So in the terms of the technology, what we have seen is the use of mobile applications that can track the virus, can locate people that they are infected, and they can assess the risk of other people to be infected by being in close proximity with the infected cases. And also by enforcing the social distancing rules through technology means. By knowing where the people are, they know exactly whether these social distancing rules and principles are implemented, and they can act accordingly. So we had these mobile applications that could share location data and which were shared with authorities in order to be able at real time to know whether social, physical distancing rules are implemented, and act accordingly.
Okay, these countries use aggressive testing, location tracking applications, as well as they analyze big data. But Benjamin, do you believe there were some cultural and political reasons behind their preparedness, let's say, or did they learn from their past experiences?
There's been a lot of preparation made in China, particularly to respond to an emerging infection. And in January, there was a really big scale up in the use of technology to get on top of coronavirus, not only by testing people to find who was infected, but then tracing their contacts and putting them into quarantine and stopping large numbers of people from traveling around the country in order to really crack down on transmission.
So do you believe in some Asian countries people are more compliant to lockdowns and quarantines?
Yeah, there's certainly cultural aspects to it. In China, it's a little bit unique because the government is able to insist that people follow these kind of instructions, whereas in other parts of Asia, there's a lot more voluntary compliance with many of these regulations. But certainly we've seen many parts of Asia have been successful in getting social distancing implemented.
All right. Now let's go to Ankara. It's kind of new to us, Emre, to have the social distancing as well as self-isolation. Success of Asian countries have shown us how crucial technology is in fighting the pandemic. Tell us about Turkey's efforts. It recently announced a location tracking system like some Asian countries have done. Will this be enough, or are there some initiatives launched to fight COVID-19?
Thank you so much. First of all, I would like to stress the new technologies are used to prevent the spread of the outbreak. We have to know that. One of the main reasons for the number of case differences between the countries can be the role of the high technology in early diagnosis. So I would like to mention about first of all, the new innovation coming from Turkey scientists in Turkey related to this topic, especially AI-based solutions. And we collaborated as our research team with Korean scientists for usage software in Turkey to achieve early detection for suspected cases and anatomic evaluation of the COVID pneumonia. So it detects the pneumonic manifestation in CT images, and it's like a mission as a triage, which means the software quantifies the pneumonia and provide us the feedback. So this is, I think, the novelty as a software, and used data of hundreds of Korean and China's corona patients. And it is very easy to uploading the physician's laptop or computer, so it can be used easily. And in another initiation, and it's also coming from Hacettepe University, our colleague Cem Şimşek, and it's really, they use the convoluted artificial intelligence system to diagnose the COVID patient with chest X-rays of patients who has admitted the symptoms suggestive of COVID-19 pneumonia.
Yes.
And it demonstrated also successful statistical analysis.
All right. Rapid spread of COVID-19 has forced countries to use every trick in the book. Georgios, let me continue with you. Is this the first time we see a rare and close cooperation between authorities, telecom operators, high-tech companies, as well as research institutions? And do you believe this will usher in a new normal when it comes to doing business and dealing with such a health crisis?
That is indeed a very good example that such a collaboration, a coordination among different major patterns, government, private sector, telecom and digital firms, can lead to something good. And indeed, this is the main thing we should keep from that. And we have used to seeing government and digital telecom actors to be on the opposite side through the regulatory framework and the proposals that were discussed under intense debate, but we see that collaboration can bring a lot of benefit. So I believe that we build a new interaction, a new norm, which we can build on as we move forward, and hopefully soon after the end of this crisis. So in order to have mutual benefits for society.
So how long it is, you think, before we see the results become visible?
It will take some time, in the sense that technology needs some time to be diffused and get some impact. And if you are talking about a virus like that, history has shown that it comes in waves, and we are just in the first wave. So I expect that such kind of technologies and the way they used and this partnership behind them will be much more effective in the second wave when it comes. Some specialists say that this will be the approximate period will be somewhere in the fall.
Yes.
So then the combination that we will have increased immunity from the first wave, and we will have these technologies in place, can bring us better results. However, let me note a final thing. We have seen so many different applications in different countries. We need some form of standardization. We need some form of coordination of the different applications that they are diffused, because otherwise we have duplication of effort, where while we could build on what the other people did and just improve these applications.
So, Benjamin, we know companies using artificial intelligence study millions of people. I mean, not only going through their medical reports, but also going through their social lives, and socio-economic factors are taken into consideration. And recently, NSA whistleblower Edward Snowden has warned that this pandemic could give governments invasive new data collecting powers that could last use after the crisis. So is Corona forcing a trade-off between privacy and public health?
Yeah, I think so. If that's the way that we want to go to get out of the lockdowns, so we find the people who are infected and then we trace their contacts and then we put them into quarantine to stop them from spreading, then the government's going to need that kind of information to be available to them. And after the end of the pandemic, the government may not want to give it back up again. It may keep hold of all of those sources of information, which is an issue that we're all aware of now.
Yeah, Georgios just recently said that all these initiatives, all these work has to be done in some sort of a coordinated way. So now that the US is one of the hardest countries by the virus, tell us about the efforts in employing artificial intelligence to find clues about COVID-19. What does the US government doing at the moment, you think?
I think there's still a lot of distance to go. We've got some access to information, but there's still a lot more that could be tapped if we want to go in the direction of using that technology. But I think in the short term, we got to focus more on social distancing and keep people at home. And that's going to go on for a little bit of time. I think the numbers of cases have to come down to a much lower level if we're going to rely on technology to then be able to track cases, track infections, and stop the spread from going onwards further.
All right, Emre, among which countries you think, I mean, these East Asian countries' strategies are more applicable and effective both for Turkey and some European countries?
Actually, we know that the responsibility of the creation of data for COVID patients is all to Turkish Ministry of Health. So we know that due to our Future Research Institute project report, we have a really strict health system, has an effective and professional data collection. So the creation of the big data, especially for the COVID patients, is crucial to maintain the applications to creation for the application AI-based for the future. So this can be the first strategy. The second strategy can be the immediate technology transfer. We know that the Minister of Health announced the new home tracking system, and it checks the patient's data, the warns when necessary, and allows patient recording data to the system for 14 days when the person in quarantine. That provides, the easy follow-up. This is already set up in South Korea and Singapore, and that that the case number is not too many compared to other countries.
Yeah, maybe after this crisis, some European countries will review their health systems. But Georgios, do you believe Europe will follow suit with Asian countries in data sharing? Because we know that they have stricter laws in data protection. What do you make of it?
I think, yeah, indeed, the privacy regulation in Europe is very strict. And the main principle is that individuals should have full control of their data and how it is used in online activities. So what I would see as a potential scenario is to build data sharing mechanisms in the case they are proven to be helpful between different jurisdictions on the basis of mutual respect of the different rules.
All right, I'm afraid we're out of time. Gentlemen, thank you very much for joining us on Straight Talk. Appreciate it a lot. It's been 1 month since Turkey announced its first coronavirus case. Since then, life has been upended for 82 million people. Non-essential businesses have shut, schools have closed, and most people have been told to stay home. And despite the rapid growth in cases, Turkey's health system has so far been able to withstand the shock. Hospitals haven't been overwhelmed like in Europe and parts of the US, but health officials warn that does not mean it will be an easy ride going forward. To get a better understanding of how Turkey's healthcare system is coping, I'm joined by Dr. Halit Yerebakan. He is the chief physician at Yeditepe University here in Istanbul. Halit, welcome to Straight Talk. It's good to have you on the program. Tell us how Turkey so far has dealt with the disease and the spread of the virus.
Thank you very much for the opportunity. Well, Turkey is lucky. Why lucky? Because for the past 15 years, it has invested so much in the healthcare that now we are actually seeing the results why this much investment has been done at first. But what we have done for the COVID-19 outbreak was that we actually set our borders a lot before the first case was tested for positive in Istanbul, which was 11th of March. What we have done, we have started to isolate our country maybe in mid-January or so, and then afterwards we have tightened our measures. And once the first case was tested positive for COVID-19, we were already had our programs, how we were going to deal with those patients, how we were going to deal with those patients, how we were going to treat them, and what was our major plan for directing these cases. We have all said it before. So what we have done, actually, first we wanted to actually isolate all the contacts of all positive patients. So if a patient tested positive for COVID-19, we wanted to isolate all the contacts that patient has done for the past 5 days. We tried to do this so much. Maybe at the first 1 week to 10 days, we were not as good because we were settling down. But currently, we can see from our test numbers, which has almost reached 30,000 a day, we can find a lot of positive patients earlier than they come up with symptoms or with further illness.
All right, tell us about the state of Turkey's healthcare system. You talked about how it's prepared, but is it close to be overwhelmed soon?
No, it's not. We have a lot of more space to go, to be honest with you, because people think that we are just like Europe. But what takes us apart from Spain and Italy is that our private sector is so powerful. Our public hospitals has a lot of capacity, and we have more capacity in private sector as well. And what has government done is that they put down a new regulation and said that all the private hospitals are also pandemic hospitals, and they will be looking after these patients. So especially my hospital, it's a private university hospital, and what I'm doing is, my facility is completely a pandemic facility,
Yes.
and I kept all the patients. So we have a lot of capacity here and all other private sectors as well. What is different in private sector besides Italy and Spain and Turkey is that in Italy and Spain, All private sectors, hospitals are mostly small clinics and like aesthetic clinics
Yeah,
or
we
so.
see that
But
some European countries did not fairly invest in their healthcare systems. That's maybe a lesson that should be drawn for it. But tell us about yourself, and bearing in mind the fact that 15% of cases in Spain are unfortunately health workers, and how well prepared and well protected you think the Turkish health workers are?
Well, I think currently Turkey is the country only in the world that has no shortage of protection equipment for the healthcare workers, which is very good for us. But that's also been done under Turkish presidency, which they had regulated the market and all collected every single personal protection equipment and lended over to hospitals for the use of healthcare workers. Besides personal protection, Turkish healthcare workers has bravery, courage, sacrifice.
No doubt about that. No doubt about that. So how have Turkish scientists, let's say, contributed to the fight against this virus from a technical point? And are there new tools or methods to be employed to fight this menace, let's say?
So, first of all, besides medication, which we also run in front of most of the countries because of our ease in clinical trials, we do implement the drugs that are said to be powerful working against COVID-19. But Turkish Ministry of Health implemented the use of these drugs earlier in the phase, so we don't have a lot of cases in the ventilators right now. But besides that, Turkish scientists, what we do, but we are in the mid of working for the vaccine, especially some university hospitals are working for it. They have isolated the live virus, and they are working for this. We have just started use of concentrated plasma, which is different than convalescent plasma, which is donated in other countries, but we have a concentration method that Turkish scientists has found out, and by this we can use one person's plasma to 3 patients or 4 patients, which is good. And then another thing, my colleagues and also I'm personally involved in, we have a patent pending in Turkish Patent Agency. We have found a medical device which we can use intravenous or intratracheal, which is directly to the lung, ultraviolet C waves. This is Turkish beam. This is light beam to disinfect and to sterilize the blood and the lungs from the COVID-19, which clinical trials also started in Turkey.
Okay. And there's also a psychological aspect of this crisis, unfortunately, as millions of people have started staying at home, which is kind of depressing and worrisome. Tell us about the ways of coping this, since Turks are kind of sociable people, and how do you think Turkish people are taking this so far?
Well, I think they are taking this very hard because, especially these days, the sun came out. The past couple of weeks, the weather was not good in Istanbul, especially. So people stayed at home. But now, I'm not really sure how we are going to put them at home. But psychologically, as you said, we are a lot social, and I'm sure, and we hear the voices of anger for the past 10 days, maybe, with increasing, but with coping this staying at home thing it's really hard. But we know one thing, and we have to be positive, especially with all my colleagues should be the positive voice, because all negative voices are already out there. What we should do, the United States says, is that they say that 1st of May, probably everything will start to be going down. What I'm telling for Turkey, it's probably after 20th of April, we will be downsloping our curve.
Hopefully. Halit, good luck with your endeavors, and thank you for joining us. That's all we have for today, but I'd like to leave you with this. The true heroes of the coronavirus pandemic have been the frontline health workers. They have risked their lives day in and day out to give those suffering a chance at survival. From all of us, we'd like to thank them as well. We'll leave you with these pictures. Until next time, take care and goodbye.